Good afternoon. My name is Rachel Carnes, and after listening to my speech, my audience will know the health benefits and detriments of daily coffee consumption and how it may impact their overall health. So, why has such a simple morning routine for most captivated and completely changed our entire world? I feel that I'm credible to discuss this topic because I have worked in the coffee industry for 2 years as a barista, and I have also personally witnessed the changes of the coffee industry myself in my time as a barista. So, in this speech, you will be informed about the pros and cons of daily coffee consumption and how it may impact your overall health. So, to begin, let us first examine how daily coffee consumption can benefit your health, or the pros, so to speak. So, there are many health benefits to coffee that are unbeknownst to many. According to Johns Hopkins Medicine, it is safe for individuals to consume around 3 to 5 cups of coffee a day, which equates to around 400 milligrams of caffeine. According to M. Gilmer from the Cleveland Clinic, on a website written about the health benefits of coffee, coffee has many compounds and nutrients that help you feel more energized and overall better. One of the more well-known compounds is caffeine, which leads the individual to feel more energized and more ready for whatever task may be at hand for them. But there are also other compounds such as B vitamins, potassium, and riboflavin. These listed nutrients are necessary for normal body functions, therefore helping the body work more efficiently as long as coffee is consumed in moderation. Once again, according to Johns Hopkins Medicine, daily coffee consumption can help prevent many diseases such as type 2 diabetes, coronary heart disease, kidney disease, and Parkinson's disease, among others. And though consuming coffee may lead to a lower likelihood of these conditions, it is in no way a way to prevent these conditions entirely. On the contrary, if daily coffee consumption has benefits, it must also have detriments, or cons. And though daily coffee consumption has been linked to overall health and overall better health, coffee can also be dangerous for certain groups or if overconsumed. According to a webpage written by I.S. Thomas and published by Spectrum Nutrition, coffee can be linked to long-term conditions such as osteoporosis, which is due to the fact that calcium is expelled in the urine when coffee is consumed. It can also lead to other physical health problems such as excessive weight gain and insomnia. Coffee may lead to weight gain due to the fact that it can cause our blood sugar to spike, which leads the body to crave sugary and or fatty foods. And if the body is consistently consuming these types of foods, it can obviously lead to weight gain. Coffee can also disrupt a normal sleep cycle because of the caffeine within it. So if coffee is consumed near bedtime or up to 6 hours before bedtime, it can disrupt your sleep patterns and lead to other problems such as insomnia, as I said previously. The preparation of coffee can also either benefit or detriment a person's health. For example, as presented by S. Putka in an article published by Discover magazine, if coffee is prepared without a filter, such as with espresso or French press coffee, it can allow harmful compounds such as diterpenes into the coffee. Regular consumption of this, quote, unfiltered coffee has also been linked to higher rates of mortality and higher rates of LDL, or bad cholesterol. Consequently, since daily coffee consumption has pros and cons, they must both work in conjunction to affect overall health in some way. So let us discuss examples of these effects. So as seen in the previously presented information, coffee has numerous effects on the body, so it must have an all-encompassing effect, but more specifically, let's focus on its effect on exercise and cognitive function. According to a scientific journal published by Nutrients and edited by C. Bamia and M. Cornelis, caffeine is a component in the majority of adults' diets and has been used by many before exercise. Though caffeine can provide a needed boost for strenuous exercise while also improving cognitive performance, some individuals may be more susceptible to its anxiogenic effects. Since caffeine may lead to these anxiogenic effects or anxiety, this correlates with other health conditions that can be caused by anxiety itself, which is also can be considered a domino effect, if you will. So since caffeine can elevate heart rate and blood pressure, this can cause risk of damaged myocardial tissue, which can also lead to having a higher risk of having a myocardial infarction, which is better well known as a heart attack. Other factors such as age, time of consumption, use of other substances, and genetic predisposition can also cause fluctuations in the effect of caffeine on the body. So now that we have seen the numerous effects of coffee and caffeine on the human body, let us summarize what we have reviewed. In this speech, we have discussed the benefits and detriments of coffee on health and the effects of caffeine, more specifically on human health. So after hearing this information, will you continue to seek your daily pick-me-up in a cup of coffee?